Welcome to NSG 315 Study Session 4, Congestive Heart Failure. Introduction. Congestive heart failure often refers to a cardiac failure, that is, the inability of the heart to pump sufficient blood to meet the needs of the tissues for oxygen and nutrients. The term congestive heart failure is most commonly used when referring to left-sided and right-sided failure. In this study session, you will be learning about congestive heart failure, its pathophysiology, nursing management, and nursing intervention. Learning outcomes for study session 4. At the end of this study session, you should be able to 1. Discuss the pathophysiology of congestive heart failure, 2. Outline the nursing management of congestive heart failure, and 3. Describe how a nurse can intervene in managing congestive heart failure. Pathophysiology of congestive heart failure. Cardiac failure most commonly occurs with disorders of cardiac muscles that result in decreased contractile properties of the heart. Common underlying conditions that lead to decreased myocardial contractility include myocardial dysfunction, especially from coronary atherosclerosis, arterial hypertension, and valvular dysfunction. Myocardial dysfunction may be due to coronary artery disease, dilated cardiomyopathy, or inflammatory or degenerative disease of the myocardium. Atherosclerosis of the coronary arteries is the primary cause of heart failure. Nursing management. The nurse is responsible for administering medication, but also for assessing its effects, both beneficial and detrimental, on the patient. It is the balance of these effects that determine the type and dosage of pharmacologic therapy. Nursing actions to evaluate therapeutic effectiveness include the following. 1. Keeping an intake and output record to identify a negative balance if there is more output than input. Number 2. Weighing the patient daily at the same time, usually in the morning after urination. Number 3. Auscultating lung sounds at least daily to detect a decrease or an absence of pulmonary crackles. Number 4. Determining the degree of jugular vein distension. Nursing intervention. Nurses can intervene in a patient with chronic heart failure by doing the following. By promoting activity tolerance. The patient's response to activities needs to be monitored, although prolonged bed rest and even short periods of recumbency promote diuresis by improving renal perfusion. They also promote decreased activity tolerance. An acute event that causes hospitalization indicates the need for initial bed rest. Rest is also required in a patient with severe symptoms. Otherwise, regular activity should be encouraged. Prolonged bed rest and self-imposed bed rest should be avoided because of the deconditioning effects and hazards, such as pressure ulcer, especially in edematous patients, phlebothrombosis, and pulmonary embolism. The patient is encouraged to perform an activity more quickly than usual for a shorter duration or with assistance initially. Barriers that could limit abilities to perform are identified, and methods of adjusting an activity to ensure pacing but still accomplish tasks are discussed. Vital signs, especially pulses, should be taken during and immediately after an activity to identify whether they are within the predetermined range. Heart rate should return to baseline within 3 minutes. Reducing fatigue. The nurse and patient can collaborate to develop a schedule that promotes pacing and prioritization of activities. The schedule should alternate with periods of rest and avoid having two significant energy-consuming activities occur on the same day or in immediate succession. Family members can be encouraged to stagger their visits to allow for rest between visits or calls. Finally, the nurse helps the patient develop a positive outlook focused on his or her strengths, abilities, and interests. Managing fluid volume. Patients with severe chronic heart failure may receive intravenous diuretic therapy, but patients with less severe symptoms may receive oral diuretic medication. Oral diuretic medication should be administered early in the morning so that the resultant diuresis does not interfere with the patient's nighttime rest. Discussing timing of medication administration is especially important for patients such as elderly people who have urinary urgency or incontinence. The nurse monitors the patient fluid status closely, auscultating the lungs, comparing daily body weight, monitoring intake and output, and assisting the patient to adhere to a low-sodium diet by reading food labels and avoiding commercially prepared convenience foods. The nurse needs to position the patient or teach the patient how to assume a position that shifts blood away from the heart, controlling anxiety. Because patients in cardiac failure have difficulty maintaining adequate oxygenation, they are likely to be restless and anxious and feel overwhelmed by breathlessness. Emotional stress stimulates the sympathetic nervous system, which causes vasoconstriction, elevated arterial pressure, and increased heart rate. This sympathetic response increases the amount of work that the heart has to do. By decreasing anxiety, the patient's cardiac work is also reduced. Oxygen may be administered during the active stage to diminish the work of breathing and to increase the comfort of patient. When patient exhibits anxiety, the nurse takes steps to promote physical comfort and psychological support. Once the patient is comfortable, the nurse can begin teaching the patient ways to control anxiety and avoid anxiety-provoking situations. Minimizing powerlessness. Patients need to recognize that they are not helpless and that they can influence their direction, their lives, and their outcomes. The nurse needs to assess for factors contributing to a perception of powerlessness and intervene accordingly. Promoting home and community-based care. Teaching patient self-care. Providing patient education and involving the patient in implementing the therapeutic regimen promotes understanding and compliance. Recurrence of heart failure, unnecessary hospitalizations, and decreased life expectancy occur when the patient does not comply with therapeutic recommendations, such as failing to follow the medication regimen properly, strain from dietary restrictions, failing to obtain adequate medical follow-up, engaging in excessive physical activity, and failing to recognize the recurring symptoms. The patient and family needs to be supported and encouraged to ask questions so that information can be clarified and understanding can be enhanced. Summary of study session 4. In this study session, you've learned the following. 1. Cardiac failure most commonly occurs with disorders of cardiac muscle that result in decreased contractile properties of the heart. Common underlying conditions that lead to decreased myocardial contractility include myocardial dysfunction, especially from coronary atherosclerosis, arterial hypertension, and valvular dysfunction. Number 2, the nurse is responsible for administering medication but also for assessing its effects, both beneficial and detrimental, on the patient. It is the balance of these effects that determines the type and dosage of pharmacologic therapy. Then number 3, nurses can intervene in a patient with heart failure by doing the following. 1. Promoting activity tolerance. 2. Reducing fatigue. 3. Managing fluid volume. 4. Controlling anxiety. 5. Minimizing powerlessness. And lastly, number 6, promoting home and community-based care. Thank you. We've come to the end of this study session.